5 real causes of GERD and why hyperacidity is not one of them. Gastroesophageal reflux disease is a condition where the acid from the stomach backs up to the esophagus due to inability of the lower esophageal sphincter to close properly. Normally, when the food gets in the stomach, the LES will close, preventing the acid to back up. But in the case of GERD, it remains open, allowing the stomach acid to reach the esophagus and irritates it, causing heartburn. In this video, you'll learn the real reason why you have GERD, so you can have an idea on how to reverse it even without taking any medications. There are certain conditions that can cause GERD like obesity, pregnancy, and hiatal hernia due to pressure on the stomach that will make the lower esophageal sphincter to lose its tone and open up, forcing stomach content, including hydrochloric acid, to regurgitate. But we're not going to talk about them here. What you're about to discover are facts no conventional doctor can explain to you. So stay tuned until the very end of this video for the game-changing revelation that could reshape your perspective about this disease. So here are the 5 real causes of GERD. Number 1 is chronic stress. We all experience stress, and it's part of our daily life. Some of us are stuck in a fight or flight response for so long, it becomes chronic. Just like a seesaw, once your sympathetic nervous system is upregulated, your parasympathetic, which is responsible for rest and digest, will downregulate, causing indigestion and restlessness. The lower esophageal sphincter will not close properly, causing the stomach content to back up. Also, when you have chronic stress, your magnesium level will get depleted, causing arrhythmia, cramping, and difficulty sleeping. You will also deplete your zinc, which can affect your immune system and the production of your stomach acid. Your vitamin B1 will also decline, which can lead to anxiety, gastroparesis, and indigestion. 2 is a vitamin B1 deficiency. B1, also known as thiamine, is an important nutrient for the proper functioning of the nervous system, heart, and gastrointestinal tract. Vitamin B1 is needed for the production of adenosine triphosphate ATP, which is the main energy currency of the cell. Your vagus nerve, the longest cranial nerve in the body that connects the brain to the gut, forming the gut-brain axis for autonomic regulation, relies on thiamine for its nutrition. If you're deficient in this vitamin, you'll have indigestion, bloating, GERD, SIBO, IBS, gastroparesis, palpitations, tachycardia, high blood pressure, anxiety, mood swings, brain fog, numbness, tingling sensations, and other cardiovascular, neurological, and metabolic disorders. However, various lifestyle and dietary choices, as well as medical conditions, can disrupt thiamine balance within the body that could lead to a deficiency such as chronic stress, high-carb diet, alcohol, antibiotics, antacids, antidepressants, metformin, birth control pills, chlorine, and raw fish. Obviously, we have a modern thiamine deficiency hiding in plain sight because doctors are more focused on medications instead of nutrition in treating chronic illnesses. Remember that your body needs nutrients to function properly and not drugs. 3. Gut dysbiosis. It can occur if there is a loss of good bacteria, an overgrowth of bad bacteria, or a loss of overall bacterial diversity. There are 2 reasons acid reflux and gut dysbiosis are linked. The first reason is that reflux might be a symptom of a bacterial overgrowth like Helicobacter pylori. This bacteria thrives in a low-acid environment, and it destroys the lining of the stomach and the first part of the small intestine called duodenum. It secretes an enzyme urease, a type of ammonia that further weakens your hydrochloric acid and stomach lining. Once the protective layer of your stomach weakens, your stomach cells then have a greater risk of being hurt by acid and pepsin, an enzyme that breaks the protein, which can lead to gastritis, peptic ulcer, or in rare cases, gastric cancer. H. pylori usually spread from person to person through contaminated food, water, utensils, vomit, and poop. You can also get it from mouth-to-mouth kissing. Most of the time it is asymptomatic, but if the symptoms are present, they may include nausea, vomiting, abdominal pain, heartburn, diarrhea, morning hunger, and bad breath. Another form of gut dysbiosis is a condition known as SIBO, or small intestinal bacterial overgrowth. Normally, these bacteria that are living in symbiosis with us are present in our large intestine. When the balance of microorganisms in the gut is disrupted, they can colonize the small intestine, causing bloating due to the fermentation of carbohydrates, particularly high in FODMAPs producing hydrogen gas. This creates belching of an aerosol of hydrochloric acid, as well as the powerful enzyme pepsin and bile, up into the esophagus and to the throat, causing sore throat, post-nasal drip, throat clearing, sensation of a lump in the throat known as globus pharyngeus, hoarseness, but without heartburn, giving rise to a condition known as laryngopharyngeal reflux disease (LPR), or silent reflux. The second reason gut dysbiosis is linked to GERD is due to medications like antibiotics and proton pump inhibitors, PPIs. They have been shown to have the potential to alter the normal microbiome by blocking acid production and wiping out the good and bad bacteria, leading to an unhealthy gut microbiota, since these friendly bugs help in immune regulation, inhibit potential pathogens, and reinforce mucosal barrier to protect the lining of the gastrointestinal tract. These same medications can also induce reflux and heartburn in long-term use. Aside from aiding in digestion, probiotics are like the peacekeepers in your gut. They are the conductors of the gut-brain axis, a bidirectional communication superhighway regulating your mood and overall mental well-being. These friendly microbes make large portions of neurotransmitters like serotonin, dopamine, and GABA. Therefore, an imbalance in the microbiome can lead to neuropsychiatric disorders such as anxiety, depression, schizophrenia, and autism. 4. Gastroparesis. Also known as gastric stasis or delayed gastric emptying, it is a condition in which the stomach empties slowly, causing food and liquid to remain in your tummy for longer than usual. This is caused by damage to the nerves that regulate gut motility, particularly the vagus nerve. Normally, when a person eats, food enters the stomach through the movement of the esophagus, where enzymes and acids begin to digest it. Muscles in the stomach contract to further break down the food into tiny pieces and propel it through the stomach and into the small intestine, where digestion continues and nutrients get absorbed. In people with gastroparesis, the muscles in the stomach are weak, cannot effectively move the food to the small intestine promptly. Food stays in the stomach for longer than usual, causing rotting and fermenting that could lead to nausea, vomiting, bloating, belching, pain in the upper abdomen, feeling of fullness after eating a small meal, heartburn, unexplained weight loss, and lack of appetite. Also, the pressure inside the stomach will exceed the lower esophageal sphincter pressure, causing reflux symptoms. In most cases, the primary cause of gastroparesis is never identified. However, there are some specific conditions known to be associated with the condition, like a vitamin B1 deficiency, since thiamine is necessary for the vagus nerve to innervate the gut through the parasympathetic response, which is your rest and digest. It also helps make acetylcholine, a neurotransmitter needed to make hydrochloric acid and induce gastric motility. Certain viruses like Epstein-Barr, herpes, cytomegalovirus, and norovirus. Long-standing diabetes can cause damage to the vagus nerve, affecting gut motility. Large hiatal hernias can result in repeated trauma to the vagus nerve at the hiatus as the stomach passes up and down between the abdomen and the chest. Medications like antidepressants and calcium channel blockers. Certain medical conditions like scleroderma, amyloidosis, hypothyroidism, Parkinson's disease, and multiple sclerosis can also contribute to this condition. And lastly, number 5, hypochlorhydria, or low stomach acid. In this condition, your stomach is either not producing enough acid, or the acid is too weak to digest your food, kill microbes, and absorb nutrients. Normally, our stomach has a pH of 1 to 3, which is extremely acidic. Hydrochloric acid is produced by the parietal cells in the stomach lining. Its main functions are to break down food and release digestive enzymes like pepsin to split up proteins. It kills food poisoning bacteria like Campylobacter and prevents overgrowth of H. pylori. It also facilitates the absorption of vitamin C, pyridoxine B6, folate B9, cobalamin B12, magnesium, zinc, iron, and calcium. When you have hyperacidity, it means you have too much acid or an acid that is too strong than normal. Remember the main functions of your hydrochloric acid: break down food, kill microbes, and help in nutrient absorption. If you have too much or strong acid, you can break down the food easily, so you won't have indigestion and bloating. H. pylori overgrowth will not happen if you're hyperacidic, since the strong acid can prevent it, and you will not have B12, calcium, and iron deficiencies if your acid is strong. Considering that you have reflux and you're hyperacidic, imagine how it feels when your strong stomach acid back up to the esophagus. You won't be able to tolerate it, since it can cause corrosion of mucous membranes, and you may... That is the reason why GERD patients can tolerate acid reflux for years, because the acid is already weak. While acid-suppressing medications may provide temporary relief, they will ultimately cause the problem to get worse if left untreated. So, what are the common signs and symptoms of low stomach acid? Primarily, you will have indigestion, which can cause bloating, burping, acid reflux, heartburn, chronic nausea, feeling of fullness, loss of appetite or hungry all the time, constipation, bad breath, undigested food and poop, low energy, brittle nails, hair loss, bacterial or fungal overgrowth, sarcopenia, shortness of breath, and irregular blood pressure changes. There are certain conditions that can predispose you to hypochlorhydria, like old age and acid-blocking medications, since both conditions can decrease the production of your stomach acid, which can lead to atrophic gastritis, where the lining of your stomach thins and shrinks, affecting the parietal cells that make hydrochloric acid. H. pylori bacteria can also weaken your stomach acid by secreting a cytosolic enzyme called urease, making the stomach less acidic, and can destroy your stomach cells to prevent it from producing more acid so they can thrive. Other contributing factors may include chronic stress, nutrient deficiencies like thiamine, zinc, and chloride deficiency, hypothyroidism, gastric bypass surgery, autoimmune diseases such as autoimmune gastritis and Hashimoto's, long-term use of birth control pills, and regular intake of alkaline water from a machine. Our stomach must be very acidic to stimulate the tone of the lower esophageal sphincter, so the acid will not backflow into the esophagus. It also maintains the tone of the pyloric sphincter that connects to the first part of the small intestine, so the bile will not reflux into the stomach, causing a bile reflux, which can further lower your hydrochloric acid since bile is alkaline. It can mix up with the stomach acid, causing irritation, and can back up to the esophagus, vomiting a bitter-tasting yellow or greenish bubbly mucus. The acidity in the stomach also activates the gallbladder to release bile. With low stomach acid, the gallbladder will become sluggish, so it will not empty completely, which thickens the bile, forming sludge and gallstone. A strong acid is also needed to release pepsin, an enzyme that breaks down proteins into smaller peptides and amino acids that can be easily absorbed in the small intestine. If your stomach acid is too low, these proteins, which are essential for energy production, cellular repair, and growth, cannot be utilized by the body, which could lead to sarcopenia, where you lose your muscle mass and strength. Sadly, the standard solution of conventional medicine to GERD is the exact opposite of what we want to do. They think that acid reflux is caused by too much acid, when in fact it's the opposite. It's when you don't have enough acid or the pH starts to go up to 4 or 5 that we lose some of the tones of the lower esophageal sphincter. The food remains in the stomach for too long, creating gas that pushes the LES. Then the acid starts to backflow up to the esophagus, causing irritation and heartburn. But doctors still prescribe acid-blocking medications like PPIs, even for long-term use, which not only make your reflux worse, but can have adverse side effects like nausea, vomiting, abdominal pain, constipation, headache, vitamin B12 deficiency, iron, magnesium, and calcium deficiency, hip fracture, osteoporosis, myopathy, dementia, hepatic encephalopathy, stroke, myocardial infarction, liver cancer, acute kidney injury, and chronic kidney disease. There is another problem with these drugs if you suddenly stop taking them. It can cause an acid rebound. This happens when your stomach makes too much acid after you stop taking an acid-suppressing medication. This extra stomach acid can cause GERD symptoms worse than before and can last up to 2 weeks. If you want to get rid of your PPI, talk to your healthcare provider about how to slowly taper it off by gradually lowering the dose each day for 2 to 4 weeks. The higher the dose, the longer you need to taper. These are the reasons why hyperacidity is not part of GERD. Even though it is not scientific and illogical, it is the basis of conventional treatment which offers minimum to no benefit at all. Patients must suffer years of indigestion because what they were told to do is the opposite of what is happening in the body. Therefore, maintaining optimal stomach acid levels is key to preventing acid reflux and GERD. So having optimal acid levels is essential to our overall and long-term health, which can only be achieved by having a healthy lifestyle. I hope this video has shed light on the genuine causes of GERD, empowering you with valuable insights. Armed with this knowledge, you're now better equipped to explore effective strategies for addressing and potentially curing this disease. Remember, informed decisions pave the way for lasting well-being. In the next video, we will unveil the secrets to naturally reversing GERD. You'll discover practical strategies, lifestyle tweaks, and holistic approaches to a reflux-free life. Stay tuned for a journey towards lasting relief and well-being. Thanks for watching. If you have any questions or need clarification, feel free to leave a comment below. I'll be happy to help.